Yes, ma'am.
Okay. So let's start with the patient care services and hospitality management basically. So if I talk about patient care means whenever any person is suffering from any disease condition, any type of emotional, physical, any kind of condition where he needs to be taken care of special care. Okay. And they are visiting to any clinic, any hospital, any daycare center. Okay, so these people, these category of people we consider as a patient. Okay, and whatever the services we are providing to treat them, to cure them, is considered as a part of hospital care. Okay, or patient care management. Okay, next part, if I talk about hospitality management, the word hospitality itself tells ki how better we are going to cater anyone related to any kind of services. Okay, so hospitality is कि आप किसी का कैसे care कर रहे हैं अवगत. If I talk about in general कि how we do that. Okay, so that is your hospitality management. So hospital, if I talk about, is somewhat nowadays is with the hospitality. What services and hospitality? What is a patient care? So the moment patient comes to, I told you, that he enters into your clinic, into your hospital, from there till the moment he gets admitted, whatever treatment we are going to suggest to that particular patient is your part of patient care services. Okay. So all patient related services, their assistance and the communication. We have our staff and everyone has communicated it. They are the part of this. Next is nursing care, because after doctor, initially when we enter, to whom we are going to encounter. First, we are going to encounter someone from the reception and someone from that part where our OPD cards will be generated. Okay, so there we need a good team for good communication, good services they are going to provide, how they are going to manage or assist that particular patient to reach their destination where they want to go. So this will be considered as a second part. Once you have been into these all these initial phases like getting your OPD card, then meeting the doctors and everything, then if you are getting admitted, or if you are getting any small kind of services, who is going to provide that? So paramedical staff and basically nursing staff. Okay. So how good our nurses are into their care and to their devotion to their patients and commitment. So what kind of services are nurses going to provide? Next is after, injection or something small dressing, something procedures or inpatient patient. If we are going to admit that patient, so how that nursing staff has been behaved, how they give their medications and everything, how they are punctual, how they are dedicated for their patient. All these things matter to a hospital. Okay. After that, other than this, another department that is called as your diagnostic services, whatever the lab services we are going to render them. Okay. So certain hospitals they had their own diagnostic centers like pathology lab, radiology lab, and other stations. Okay. But certain hospitals they had the outsourcing. So in scenarios where insourcing of these diagnostic services are there, in same scenario, all these things matter for the image and reputation of the hospital. Ki how good the diagnostic centers are and the people working into those centers. Okay. Next is housekeeping. So whenever you are getting admitted, you need to encounter with these kind of people. Or if you're not getting admitted, still if you are using their washrooms or something, then still you need to encounter the housekeeping services. Okay. In rare conditions, we need someone from the blood transfusion service. Okay. In severe conditions where we need a patient is lacking on all these things, there we need someone from the blood transfusion team. We get from the blood bank, we need to get a blood and we need to do the transfusion. Before transfusion, we need to go for the RH factor testing and all those things. So how good that particular team is. Okay. Then cafeteria and dietary services. If you're admitted, definitely you're going to have certain amount of food. So what kind of, and what quality of food that particular hospital is offering to their patients and the family members. Okay. Next is a proper and respectful disposal of the decreased person. If worst scenario, the patient dies, how they dispose that. So whenever you are seeing if someone has died into the hospital on the table, anything, they need to clarify how the patient died and what all things. Okay. So priorly they informed everything as the patient condition is deteriorating and everything happening. Okay. But in worst scenario, what they are going to do if the patient dies, they properly dispose that person. फॉर्मल फैमिली को लास्ट मीटिंग करवाते हैं पेशेंट के साथ. आफ्टर दैट वी properly pack that dead body. Okay. So how we are going to pack? पूरा उसको क्लोज करके और हम उसको पेशेंट को एक रैप गॉज शीट में रैप करके देन वी कवर द बॉडी इनटू द baggages and white sheets. Okay. This is how we basically do into the hospital. Okay. And secondly, they do go for a postmortem also. Now coming to the hospitality management, to visualize the future needs and expectations of the community from the hospital. Okay, so why we need to do? I told you, the hospitality means see how good we are in rendering the services, in catering the person's emotional needs and everything. Okay, so in on the basis of future, if I talk about, so future respect में a lot of market में competition with a competitor. So very important thing, being a healthcare professional, being a hospital part, we should provide the best hospitality. Okay, patient didn't feel because if you are depressed, if you are in tension, if you are suffering from any disease condition, you're already in a very negative mindset. So when you are entering into hospital, why you will go there? Either their staffs are very good, either they are very friendly, either they are very talkative, caring, and they understand or provide the best services. That's why. So nowadays hospitality is very playing a very important role into any kind of management. Okay. So treat your patient, treat like your guest. Okay. So I told you कि आप कितने अच्छे से उसका आवभगत करते हैं, उसको treat करते हैं. So whenever your patient is coming to, you should be either feel the part of your family, like family member or like a guest. So if they are more confident into you, if they are more invested into you, then only they will make multiple visits. So whenever we are treating any patient, most important thing is we need to build a good rapport with them, build a good uh, bond with them. Okay, and other than this, trust. That particular patient have a trust into us because he is investing a money. Whatever the money they are investing, for our services, we should fulfill or overcome with their expectations. कि this is their expectation or this is their state of dilemma. Okay, so we should overcome with all such kind of challenges. Okay. Next is changing the mindset of the patient, necessities and hospital management. Okay, so whatever the mindset of the patient, if you feel is too negative, is too difficult to manage, either you should change their mindset, this is not this, this is the exact way how we are doing. So convincing part should be either very good or trust should be developed gradually. Otherwise, we should have certain ways in psychology through which we manage these kind of patients. Okay, aims and objectives of the hospital management is and the commercial points. Okay, so what is the major hospitality management is? see how good we are going to take care of that particular, what kind of in basic if I talk about in Hindi, what we call it as कि आप अपने अतिथि का कितने अच्छे से आवभगत करते हैं, ठीक है, how good you are taking care of your guest, okay. So अतिथि सत्कार जो होता है, that is the exact meaning of your this hospitality. So main objective of hospitality management is कि how good we are to cater those services to anyone, okay. Next is methods of hospitality management in hospital setup, because in hotel management system it is easy to manage, but in hospital management system it is very difficult, because same time we have to provide the treatment, because patient's life is very important. But what happens in this hotel management, depending upon the patient person's pocket we manage, okay. But here we have to save the patient's life, that is our most top priority from wherever he is belonging, okay. So along with this basic concept, the patient life is very important. We need to give them the best services. Along with hospitality management is little bit tough task, but still we are trying to manage these things. Okay, attractive look, effective conversation, and multilingual and smart dresses. Okay, so whenever nowadays if you're going into the hospital, everyone has their own dress codes, okay. Paramedical staff, nursing staff, okay, RMOs, they are having their dresses, okay. And secondly, the multilinguistic staff they are going to manage, okay. The person, why they cannot speak, English, so we need a someone from that particular local language, okay. He can speak that local language. For example, that worker has migrated from North India, and he is going any hospital into the South India. So what there we need, not only that, for example, Kerala में है तो या किसी में भी है तो उनका local language staff should know a little bit of Hindi. Then only he or she can treat the patient from the North India. Otherwise, they cannot understand, because lower class people they don't have access to or very good vocabulary or communication skills into the English. But what we can do, we can train our staff to learn multilingual languages or multistic approaches. Why? Because okay. Next is effective communication. So communication play important role. Attractive looks. Next is role of hospitality management in hospital setup, and lastly, the equities and the manners. Basically, okay, whatever may be the basic equities, basic manners that should be followed. Okay. Next is starting with the first topic, that is the patient admission and discharge. So admission defines as allowing the patient to stay into the hospital for the observation, investigation, treatment, care, whatever is the need of the patient. Without any need, we cannot admit anyone. But if there is any necessity, अगर कोई need नहीं होता है, तो how we will take care of the patient on OPD basis. But if there is a need, if there is requirement, the patient should be admitted and taken care under the observation. In that scenario, we admit the patient. Okay. So admission is defined as allowing the patient to stay in the hospital for observation, investigation, treatment, care. Admission is entry of a patient into the hospital oblique ward for therapeutic oblique the diagnostic purposes. Okay. What is the purpose of admission? So to receive the patient into the ward for admission according to his condition, to provide the comfort and safety to the patient, to provide the immediate care, to be ready for an emergency. So these are the basics. Whenever the patient entered into any hospital for admission, what is the major conditions? Either he met with a trauma, either he's very serious, either it's any kind of emergency condition where the patient need a immediate treatment from any professional healthcare doctor. Okay. So during these time, he turned into any hospital for admission. And when the patient is entering into the admission or turning into admission, what all things we need to take care कि अगर patient को हम shift कर रहे हैं तो proper safety should be followed. अदरवाइज आप पेशेंट ट्रॉमेटिक है, आप उसको प्रॉपर हैंडल नहीं कर रहे, मे बी कंडीशन, सो सेफ्टी शुड बी अगेन अ वेरी इंपॉर्टेंट जोन. ओके. Then if you're delay into the care of patient, for example patient को immediate care की जरूरत है and आप उस care को delay कर रहे हैं, that means कि lead to the death of patient also. Okay. Immediately अगर हम patient को emergency condition में cure नहीं करेंगे तो what happens कि negligence leads to the death of the patient. Okay. Next, principles and important point involving the admission of the patient. Sudden change in the environment produces fear and anxiety. Next is entering the hospital is a threat to one's personal identity. People have diversity of habit and modes of behavior. Illness can be novel experience for the patient and bring stress in the physical and mental health. So majority of people when come into the mind, ki you need to be get into the hospital and now we are going to admit you. When this word comes, ki we are going to admit you into this particular hospital for further treatment. What happens? Patient he start feeling depressed. He might be I'm not in state or maybe there is something very serious. Doctor is not telling. Multiple of thoughts coming into their mind. So in this scenario, what is the major role of that particular doctor or staff? Ki no, this is not something serious. We are going to cure. Definitely, you don't need to get panic. Okay. So whenever the word hospital and the admission come, patient feels ki there is something that is very serious condition. That's why they are going to admit me. Okay. Second thing, ki if being a medical professional, when we are treating anyone, what happens basically? The patient, wait a minute. Hello. Sorry. So sudden change in the environment. For example, आप घर पे है, आपका एक different environment है. But when you comes into the hospital, there is a people. Everyone is into state of depression, in state of disease condition. So what happens? That contribute to your mental health again. Okay. So what that hospital environment will create a fear and anxiety. Okay. So that is the environmental changes. Like into the hospital, everyone was into deep pain, deep, tension, stress, disease conditions, severe disease conditions. So that also contribute to your mental health because of change into the environment. Okay. Next is your actions. Okay, so basically, if I talk about into the hospital, 95% people का white collar से बहुत ज्यादा पेन एसोसिएशन एक्सपीरियंसेस होता है. सेकेंड थिंग दे हैव अ नेगेटिव एक्सपीरियंसेस और from the other people experiences they feel a lot of negative things. And lastly, if I tell into the hospital, the patient with a different behavior like stress disease condition or into their habit disease condition, everything जो है वो आपका एसोसिएटेड होता है. Next is your action. The personnel in admitting department should be instructed to give the respect and establish a healthy relationship to gain the confidence and cooperation of patient and his family. Okay, so these are our actions. We should provide such kind of assurance to them. Ki don't worry, we will try to cure you or keep you into the healthy environment. Next is the nurses should make an effort to be friendly and courteous and make him feel that he will be receive a sympathetic as well as effective care. So, so this is our again I told you ki why the paramedical staff should be multilingualistic. Okay. Talking to the patients and clarify their doubts, listening to their problems, introducing to the hospital department, hospital personnel and other patients, explaining the hospital routine, taking care of the valuables, giving the explanations for the treatment, allowing the family members and friends to spend some time with the patient, and above all, establishing the effective nursing patient relationship that can reduce the fear and anxiety to a greater extent. Again, I told you ki why we need to have a good communication with the nursing staff because the patient is into the state of dilemma. Okay, they are into the state of stress. So what they want, ki there should be anyone who can understand us. So that's why we make ki okay, patient ke saath ek family member stay karega. Then we have a visiting hours where their family members, their friends can come and meet them. So what's the reason? The basic reason is that only okay, they should feel good. Okay, patient should get stress free life. Okay, the nursing should address them thereby names and proper title. So why we address with their names? If I'm calling you by your name, so you'll think no, this is more friendly. The close one people knows our name. But if I'm calling bed number, patient number, so they will not feel good. Okay, that's the second thing. So to make them more friendly, that's why we call them with their name and proper title. Allow the patient to use their own articles as far as the hospital policy permits. Like everyone is comfortable with their own thing. So
Hello,
we should have certain
hello,
yes,
ma'am. Your
yes.
voice is like there's feeble. It's breaking in between.
Okay,
It's not clear.
okay, wait a minute.
Might be there's some net connection issue.
Now it's clear.
Hello.
Yes, now it's clear.
Yeah, yeah. Now it's clear. Now it's clear.
Okay. So we should always allow the patient to use their own articles. What's the reason for using their own articles? So they will, everyone is comfortable with their own things. For example, hospital, they are concerned with what kind of things hospital is providing, what is the quality of that product, or maybe so there are certain policies into the hospitals, not every hospital, where they allow certain limit. The patient can use this of their own. Okay, why we are not allowing everything that patient can use of their own? Because of sterilization protocol. So only those things which cannot affect our day-to-day activity, or if patient is suffering from severe disease condition where the hygiene is very important, in that scenarios we don't give permit to use their own articles or bring their own things. Okay, but the scenarios where we can give freedom in that areas or in those particular conditions, we allow the patient, they can use their own articles. Okay, or their own things. Find out like likes and dislikes of the patient, including in the patient in his plan of care. He should feel that he is considered and cared for. So again, why we try to take care of what is the like and what is the dislike, especially when we are taking care of any pediatric, uh, a patient like child, when we are taking care of small. children in that scenario, we need to consider what is their like, what is their dislikes, because they are very choosy group and not easy to handle. So in those scenarios we need to take care. Second, when we are offering food into the hospital, so dietitian asks, you used to eat this, आप ये खाते हैं ये नहीं खाते हैं. Why we used to do that? Because patient को ऐसा ना feel हो कि वो एक hospital में है. Negative psychology को reduce करने के लिए we specially have a conversation with them prior to providing meal. So as per their taste bud, we can provide them. So it should be healthy same time. Plus the choice of food is according to the palate of that particular patient. Okay. So patient की choice का food हम provide करवाते हैं, but along with a nutritional care. So dietitian used to ask me, you used to eat tomato, नहीं खाते हो, क्या खाते हो, what is your North Indian, South Indian, जो भी food उसके choice का होता है, उसके basis पे उसको daily requirement dietary की कितनी है, we decide and we provide them. Okay. Next is your hospital routine should not be too rigid. Example, some patient not to wish to be dressed in hospital gowns. So again, why we are not allowing the patient to wear their own dresses or something? Because of protocols. Okay, hygiene protocols की वजह से या sterilization protocols की वजह से we allow them to wear the gowns. Again, the everyone into the hospital who is getting admitted, certain category of people is not comfortable with those sets of dresses, so we should provide them or give them options to have their own gowns or dresses what they want to wear, but we are going to sterilize those things. Okay, whatever the dresses they are going to wear. Every nursing should understand the behavior patterns of the patient according to his age, sex, race, caste, and socio-economic factors. So again, if we are working into these kind of hospital setups, the patient behavior, human psychology play important role, or very important role in taking care of that particular patient. Okay, so you can see based on age, I told you already, if I talk about any child, children are very conscious about their certain things. If you go into the girls, they had their own demand. If you go into the category of boys, they have their own demand. Okay. Again, if you are going into the adult age, they had their own demands. They need something into their, like the people from 15 to 25, 30, उनको क्या है lively environment चाहिए. They need a lively environment. So we can design their architecture or room should be like that. Ki they should feel lively into that. Okay. If we are going into the old age, they were more towards the spirituality. They are more towards the, psychology that should be very calm and quiet lifestyle. So we can design their rooms according to that. So again, what I'm telling you is as per the different age groups, the patient behavior, their mentality, and their thinking process, everything should be going to change. So being a nursing staff, being a medical staff, or being healthcare provider, we should understand every age group, we should understand every race, we should and properly respect them. Okay, we should not do any kind of behavior that shows ki they are disrespected. Okay, so that play a very important role. The nurse should recognize the various needs of the patient and met within without any delay or within the limited time period. Okay, so as per the particular female patient, maybe I had a certain different needs. So being a medical staff, nurse should recognize the needs and meet those needs without any particular delay. Nurse should give the proper explanation without the disease, its prognosis, and its complication within the complication and language of the patient can understand. For example, if I'm doing any treatment, ट्रीटमेंट करने के बाद मुझे पोस्ट प्रोसीजरल और पोस्ट डिस्चार्ज फॉलो अप इंस्ट्रक्शंस पेशेंट्स को देना है. But for example, during the hospital care, my nursing staff is doing that part. So whatever the language I'm speaking, the nurse will able to understand. But if certain instruction when the patient is getting discharged and I'm giving into my own language, so that their family members, that particular patient is not able to understand, do you think they can take care of those things? No, that will create a complication of my treatment. Okay. They will not follow my instructions and they will turn up with another disease condition. For example, most common condition I'm telling you, keep whenever we doing just from a clinic, I'm telling dental clinic. Okay. आप कभी extractions करते हैं, there is a huge list. आपके एक्सट्रैक्शन के बाद क्या बोला जाता है पेशेंट को कि गॉज को जो है, जो भी प्रेशर गॉज किया गया उसको 30 मिनट्स बाद स्लोली रिमूव करना है. फॉर वन डे आप जो भी खाएंगे ठंडा खाएंगे, पाइप से कोई चीज नहीं पियेंगे, पानी भी पियेंगे तो सिप सिप में पियेंगे, कोई भी चीज प्रेशर से सक इन नहीं करेंगे, सक आउट नहीं करेंगे, गार्गिल नहीं करेंगे, स्पिट नहीं करेंगे, कुल्ला नहीं करेंगे बेसिक में. व्हाई वी कॉल्ड ऑल दीज थिंग्स? सो आपका जो क्लॉट है वो डिसलॉज ना हो जाए. अगर पेशेंट फॉलो नहीं करता है ये सारे इंस्ट्रक्शंस को, तो व्हाट हैपेंस कि क्लॉट डिसलॉज हो जाएगा और वहां पे बोन एक्सपोज हो जाएगी. When bones getting exposed to different kind of bacteria, what it will cause? It will cause disease condition. And very painful. That particular disease condition is very painful. That's why जो post discharge या post procedure explanations हैं, वो patient की own language में दिया जाता है. Why? To turn the prognosis good. Follow up prognosis जो है हमारी अच्छी हो सके. That's why. Okay. Now coming to different types of admissions. So what all things we are having as a part of admission? Anyone can tell me कि किन किन conditions में आपके admissions होते हैं? Okay.
Multiple conditions like.
कौन सी condition? हाँ जी.
What is the question? Like what are the conditions for
hospital में admission लेते हैं? What all different conditions where we take admissions into the hospital?
Moderate to severe sick patients.
Moderate. Okay.
Whether there is an intervention needed for medical interventions or surgical intervention, emergency, road traffic accidents, RTS cases, and any pandemic or epidemic challenges like SARS-CoV-2 and all, where there is respiratory challenges or compromise, like and all.
Okay. So these are the different conditions where we are going to hospitalize the patient. Okay. So if I talk about what are the different types of admission, first of all thing is कि patient कब सबसे पहले hospital में आता है, तो that is your emergency admission. Okay. Emergency admissions means कि patients are admitted into the acute conditions that require the immediate treatment. For example, patient met with any kind of accidents, roadside accidents हो गया, office site या construction site में any accident हो गया. Next category in India is your attacks. Okay, so आपके heart attacks होते हैं. After that is your next condition, if I talk about, is your poisoning, food poisoning or any kind of poisoning, suicidal intentions, ठीक है, diarrhea, dysenteries, and acute appendicitis, shocks, hematosis. These all conditions are your emergency where if any kind of delay can lead to the death of the patient. Okay, that is our first category. As patient comes to the emergency according to his or own condition, अगर वो बहुत serious नहीं है, so they can come on wheelchair. If they are very serious, they cannot walk by themselves or even cannot sit properly, loss of consciousness hai, so mostly they are brought on a stretchers. Okay, or they are not able to move in that scenario. Provide bed and privacy of the patient. Take the brief history and complaints of the patient. Agar patient खुद से बता सकता है, well and good. If they are not able to communicate by themselves, in that scenario we obtain from their relatives. Okay, check the vitals, call the doctor on duty, carry the doctor's prescription accurately, allow one caretaker to be take care of that particular patient's need, check the medical records of the department, prepare a patient folder, see all the details are entered or not. If the patient is required, ask the doctors to give permission forms and ask the caretaker to sign that particular consent before, if we need to do any kind of procedures or treatment, we ask them to sign that consent. Okay, and that consent should be explained properly to the patient. Okay, patient is shifted towards after the ward giving the initial care. If emergency is busy, then request the particular ward to come and take care. So initially patient अगर severe condition में आता है, we admit them into the particular emergency room, okay, or region. Once the condition is stabilized, we gradually move the patient to the wards. Okay, no patient should be sent without any treatment. अगर patient की condition severe है, he need an immediate requirement of treatment, so we give all priority treatment, and without treatment we cannot discharge anyone. Okay, so initial first line of treatment अगर आपको refer भी करना है, in that scenario we provide them first line of treatment and then we refer them further to the another next level hospitals. Okay, next is your routine admissions. Routine admissions were like a patient with, these are something what I can call as a routine admission, or I can say it more properly as a planned one. Okay, so for example, chronic renal failure condition, CKD, dialysis, आप alternate में देते हैं, either you give on a Tuesday, Thursday and Saturdays, either you give on a Monday, Wednesday and Friday. So these are the planned conditions basically. उसके बाद से पेशेंट को कोई ब्लॉकेज है, हार्ट ब्लॉकेज है, वहां पे आपको एंजियोग्राम या एंजियोग्राफ्ट करना है, आपको बेसिकली एनी काइंड ऑफ ग्राफ्ट procedures you need to perform into that particular blockages. So again, all these categories on the basis of your investigations and प्लान ट्रीटमेंट एंड सर्जरी. ओके, बेसिकली आपका हर्निया हो गया, जॉन्डिस हो गया, डायबिटीज हो गया, हाइपरटेंशन हो गया एंड क्रोनिक हार्ट फेलियर्स हो गया. तो इन दीज प्रोसीजर्स व्हाट इज दैट कि what all things doctors check prior to, they check bed availability on that particular day. Second thing, what is the patient vitals, is he or she is okay to perform that particular procedure. Next is your weighing machines. We there is a proper list of post procedural कि आपका PT कितना है, CT कितना है, weight कितना है, vitals कितने हैं. So all those physical examination should be done, and on the basis of that we perform the admission. Okay, so patient case sheet and progress note, investigation forms, uh, intake and output chart and admission consent form, bed bar tray and bed pan or urinals. In cases where if we are performing any kind of surgery, then patient cannot see, in severe conditions, so we provide them with a bed pans or urinals. Okay. So activities carried out in outpatient department, reception of the patient, the personnel in admitting the department should read the patient and make him at ease. In emergency condition, no time should be lost to initiate the treatment. Recording of social and medical data. The class in the recording section is responsible for recording the certain data that are essentials. Okay, so what all data, for example, the moment you are entering into the hospital for any kind of admissions, so what all data should be important. So first of all is your identification data. आप hospital में enter कर रहे हैं, what all information we ask to you कि आप अपना आधार दिखाइए, पैन दिखाइए, that is the unique identification card.
कि second thing, once we fill your demographic data, then patient will answer certain questions like uh, what is supplies to, if they are carrying any kind of gold or anything, we ask them to call their family members or friend, and we handle all the ornaments to them prior to that. So why we do all those things, or we ask the emergency contact number? Why? If something happens, who is the person of contact in those scenarios? On the basis of outpatient, we ask all these things prior to procedures. Okay, and we take, once the patient come on outpatient basis, what we will do is we take a medical history. आपका demographic data हो गया, you tell कि where was the reason of visit to this particular hospital. Once you tell your reason of visit, we allocate particular department to you, a particular doctor to you. You make your appointment with that particular doctor, you visit that particular doctor. Once you start from there, what is the main basic procedure of that doctor? He will take your medical history. Okay, he will check what is the medical need of that particular reason, why he is visiting to that hospital. So that is your chief complaint. Next is your, he will check your BP and basic जो भी आपका patient records, he will take treatment records की past treatment records क्या है, what is your current BP, what is your scenarios, and if needed he will go for further investigations such as x-rays हो गया, lab हो गया, CBC, lipid profile panel, whatever is needed, again performed by that particular doctor. So why we do all those things? It will be easy to understand the past history of the patient, what is the exact disease condition, and what is the history of the treatment. The patient from OPD. Okay, so I told you till now there are three different types of emergency में patient आया, then he needs treatment. Initial treatment देने के बाद हम उनको IP में convert करते हैं और wards में. ठीक है. Second is your, that is called as ER to IP. Okay. Next is your planned IP. Okay. Third is your OPD to IP. Okay. So आप patient, थर्ड इज योर कि आपका ओपीडी में ओपीडी में बेसिकली पेशेंट आया और on the basis of treatment you find कि no vitals are very high, patient need immediate care, immediate treatment, तो आपने उसको जो है उस ओपीडी को आईपीडी में कन्वर्ट किया. So activities carried out from OPD to IPD. So these are the basic three categories of admissions. Okay. That how we do usually. The patients who are very ill and allowed to walk and escort to the clinical divisions by the nurses or the attendants, that I already told you. Whenever the patient is coming into any of the department, either ER, either IP, either OPD, what we basically check, that patient can walk by themselves, we allow them, okay, with assistance. Okay, if the patient cannot walk by themselves, they need a wheelchair, so we allow them, okay, you can sit on the wheelchair and there is an attendant, they can take to the particular department. Third is patient is not even responding, बहुत severe है, responses नहीं, subconscious loss है उसका, alert sensations है, in that scenario, or there is a certain history of trauma or he met with a certain accident, so in that scenario he will be brought on stretchers. Okay, so depend upon that. Seriously ill patients should never be left in the hands of untrained professionals. That is second important thing. If whatever the staffs we are going to have in our hospitals, there are, if we being interns, we had our seniors. So interns are in their training phase. They are not that much trained. So untrained professionals, we are not going to allow them. Okay. So there is always a trained person or a senior person to handle any kind of severities, okay, with a patient in cases of seriously ill. Okay, a female should never be left with a male attendant. ठीक है, तो that is again a very this I can say very important point ki whenever we are working into any hospital setup, female patients should not be left with any male attendant. Okay. Next is the reception. So whenever the doctor is doing any kind of physical examination into the female, or they are performing any kind of X-ray, CT, MRI, whatever, they need a relatives of the female. Okay, whether any sister, mother, whosoever is, they can come and see what is the exact procedure going on. Next is the receptions of the patient by ward sisters. So the ward sisters or the nurses admitting the patient introduces the greets the patient and his relatives and make the effective nursing patient relationship. So for example, whenever the patient is admitted to any kind of ward, so what is the main importance of the nursing staff over there, or whatever the sister nurses or ward sisters, they usually come and meet and introduce themselves. Ki, hi, my name is this. I'm the one who is going to take care of this from this to this time period, because the ward sisters, they have a working hours. So मैं इस टाइम पे आपको अवेलेबल हूँ, आपको कोई नीड होगा, जस्ट ring whatever the room it is, uski sari functionalities ko bed ke side pe there is a panel or there is a box jahan se aap ring karke apna nurse ko bula sakte hain. Next, if you need any kind of up and down movement adjustments with the bed, you can do it by yourself. So there are switches present on that, so they will explain everything to the patient. If you press this, bed will go down into this position. If you press this, bed will come up into this position. If you need this, you have to do this. Okay. So they explain everything. प्रोसीजर हुआ है, प्रोसीजर के बाद आपको ऐसे ऐसे ध्यान रखना है, ठीक है, आप बेल प्रेस करेंगे, मैं आके ये ड्रेसिंग चेंज करूंगी, वॉट एवर इज द रिक्वायरमेंट, दे एक्सप्लेन इट टू द पेशेंट एज वेल एज देयर family members. So what is this? They are introducing themselves, they are greeting the patient, they are making a bond or relationship with the patient. If the patient is very sick, she should put on a bed immediately. The patient who is not very ill can be allowed to make a rounds in the ward. That is a very common thing. कि आप बहुत ज्यादा सिक हैं, आप उठ भी नहीं सकते हैं, तो आपको बेड केयर की प्रॉपर जरूरत है. इफ यू आर एबल टू वॉक एंड डू योर थिंग्स, so आपको आपकी बेसिक डे टू डे एक्टिविटीज अलाउ कर दी जाती है. यू कैन वॉक एंड डू योर बेसिक वर्क इनटू द हॉस्पिटल्स. ओके. Orient the patient to the whole ward. So again, we are going to explain the orientation is what? Explanation. What kind of hospital we have, what kind of ward we have, what are things into this particular room, that I already explained. Okay. So we explain everything. For your entertainment, you can use TV. This is there you can get a water dispenser. This fridge is for you. Everything, whatever into the wardroom, we need to explain that particular patient. What is the visiting hours? What is the how many attendant can stay with them? What is the attendant protocols? What is the patient protocol? And it's meantime with the patient, attendant with the patient, we need to explain them how they are going to take care of that in their absence. Okay. So all those things we need to do. Okay, explaining the hospital policies, procedures, routines to the patient and his relative, helping the patient to occupy his bed. Okay, his temperature, pulse, respiration should be recorded at time of admission and later on the regular basis. So these are the basic things which we need to observe. Okay, कि post procedural में आपको patient का जो भी nursing staff है उसको इन सब चीजों को maintain करके रखना होता है on daily basis. Okay, and record the patient data in admission register. Special equipment such as if patient is given on oxygen, suctions, cardiac monitor, or emergency trolley should be there for any emergency. So if the patient is severe, so we need to always ready with the emergency trolley, जो कि आपके emergency medicines को भी contain करती हैं. So in the need of emergency, we should administer all those things to the patient in order to save his or her life. Helping him to change his dresses according to the hospital policy, and bed bath for the bedridden patients who cannot wake up, okay, or walk, okay, or bathroom bath for the ambulatory patients. Okay. The nurses makes the agreement to carry out the investigations ordered by the doctors. So all these things should be done when the reception of patient and clothing, that I already told you. Okay, prior to the this admission, if or any kind of surgeries, if they are wearing any ornament or something, we should ask them to hand over to their family members. Okay, second thing, if they are carrying any kind of dirty clothes or something, that should be sent home by the relatives for the washing and cleaning purpose, or we can do it in our laundry on once they agree for that. Okay, clean clothes should be kept safely for the daily uses. Okay, once we get a clean cloth or sterilized cloth, we kept it properly so into the bags so they can use. Okay, in absence of the relatives, there are numbered labels and kept in the store until such time that hand over to the relatives. So for example, अगर हमें कोई procedure perform करना है, हमने patient की dressing और सब कुछ अपने हिसाब से change कर दिया. So what we used to do, we used to carry everything of the patients into a bag or polys with their bed number or with their name, every detail kept safely. Once anyone from the family or their relatives comes, it's our prime responsibility to hand over them. Okay, never throw any belongings to the patient. So patient के personal belongings को we cannot throw. It is something he treasures. Might be it seems like it's a piece of cloth or something for us, but maybe it's a very important for that particular patient. Okay, negligence in handling the patient belongings brings the criticism upon the hospital and makes the personal and other patients liable for suspicious. So if we do, we will consider as a irresponsible behavior towards the hospital. Okay, so we can trace such kind of behaviors because maybe so that's why we need to treasure them. Encourage the patient to send the jewelry, money, and valuable things such as radio, watch, plane. On discharge or death or transfer of the patient, nurse should see that the clothes and other valuables are returned to the patient or his relatives and get the receipt from the patient or the nearest relatives and keep it safe. Otherwise, they can blame us. In cases of decreased or dead patient, we have removed certain ornaments or certain valuable things. So whenever we are returning all those valuable things to the patient or their family members, we should get receipt of that. Okay. The nurses are responsible in the admission, prepare the unit and keep the bed ready. Whatever may be the need, we do it accordingly as per the patient's need. Okay. For ambulatory patient, the normal position of the bed, a patient on the stretcher, the bed is on the lowest position. Okay. So as per the patient's need, we change their bed position. Entry of the patient into the admission register with identification data, date of admission, diagnosis, and inpatient number. These are the basic things which we need to maintain on the basis of admission. And it was done by always as a nursing staff or paramedical staff who is taking care of that particular ward. Okay, or working on that particular ward at that particular time. Okay, so that nurse is responsible for maintaining all these data. Okay, yeah, bed sheet kitna hai, bed bath kya hai, article number kya, everything, whatever the medical supplies we are giving to that particular patient, we need to maintain the data. Assemble the special equipments and supplies like oxygen cylinders, cardiac monitors, everything should be done. Okay, nurses should have make the effort to be friendly and courageous with the patient. proper observations of the patient condition, orientation of the patient with the hospital policies, observation of the policies into the medical cases. This is something very important. Anyone can tell me what is medical legal cases?
Hello, 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 hello.
Yeah, I'm audible.
मैम ये
हाँ जी बोलो
वॉइस वॉइस में वॉइस टूट रहा है.
अभी भी.
हाँ, बीच में आपने क्या बोला वो समझ में नहीं आया, मतलब.
मैंने पूछा कि what is medical legal cases?
Okay,
Any idea?
medical legal. Hello,
Yes,
am I
medical
audible?
legal. Yes, you are audible
Medical
to me.
medical legal cases are known as MLCs. Those cases which basically suppose even in the trauma cases or poisoning cases or murder cases or attempt to murder cases or any doctor's
Hmm.
negligencies by the hospital, by the authorities or the administration negligencies, if a patient suffer from any severe adverse events or effects or death, those things are basically counted as medical legal cases, and which has been proceeded into the court for further this one investigations, and mostly this process is called as, like, medical legal procedure.
Okay. Medical legal cases basically I can medical legal cases can be basically those cases that can be as a result of any kind of injury or any kind of alignment of injuries, or I can say investigations where we need a law enforcement like abuse, physical abuse, sexual abuse, any kind of abuse. Okay,
Exactly.
or threat to life or attempt to
Fair to life. Hmm.
killing, like you
Hmm.
attempt to murder someone, you as you said. Okay, so
Hmm.
all these cases where we need to do certain kind of investigations. Okay,
Yes.
so once the doctor meet with that particular patient, they decide on the basis of sign and symptoms ki what is the exact category of that particular condition, whether it's a fall or it is an attempt of murder, or any kind of assault is done to that patient. So once they will decide ki what is the exact category of that particular case, they immediately inform the nearest police stations.
Police station,
Okay,
yes. The
for
police
the
come for the inquest.
yes, so they
Even
can
the
investigate
snake
under the
snake poison,
section 39.
yeah, the
Yes,
snake poisoning, like snake bites, scorpion bites, stings, and all everything. Those also nowadays falls under medical legal cases. Emergencies.
definitely. So where we need to investigate, is there any criminal procedural is involved into that particular treatment condition or that particular medical condition. Okay, so in those scenarios, there is a huge section under section 39. There is a huge list of what all conditions are coming under as a criminal suspect into the medical conditions. So under that particular section of 176 or 202 of the Indian Penal Code. So on the basis of that, we must report the police visit to the patient, and they will investigate accordingly. So all those cases where legal cases, and we had a different observation policies into that scenarios. First we give emergency treatment to the patient, but we cannot change anything. Personal things of the patient, we cannot change their dress. May be considered as a, I can say, what proof or investigate proof to that particular Doctor, you can, for example, blood stains are there, or any, you can get a bullet or something from the, when you're treating the patient, you need to preserve all those things. Maybe they will consider as a investigations. Okay. So that's why there is a different observations of these medical cases. Clear now?
Yes, ma'am.
So recognize the various needs of the patients and meet you need a 5-10 minutes break so we can start